Welcome everyone who's here both in person and online to this morning's seminar looking at getting fit for surgery. So for anyone who hasn't been into HFRC before, who might be watching online, HFRC is a multidisciplinary allied health clinic who has a special interest in orthopaedic rehabilitation and managing complex musculoskeletal conditions, both pre and post surgery, and also those people looking to avoid or delay the requirement for surgery from there. So on site, we have a fully equipped rehab gym, as well as our private treatment rooms, utilised by our exercise physiologists, our physiotherapists, and our remedial massage therapists. So today we're going to be talking about getting fit for surgery. So first of all, why do we want to become fit for surgery? Well, there's really three key aspects from my perspective why we want to get fit for surgery. The first one is about getting in the best physical shape to get the best outcome from your surgery. It can also help to reduce complications, both in terms of medical complications, but also complications from your surgery, and also getting mentally prepared for your surgery as well. So during exercise, we can talk about some of the other aspects of things that we need to get ready. Now, when we look at getting physically prepared for surgery, what is the key factor that we're trying to overcome in terms of us getting fit for surgery? And this really relates to what we refer to as the pain and inactivity cycle. So one of the reasons why we are looking at surgery, and today we'll talk a lot about hip and knee replacement, the key factor is pain. It's pain that's driving us to, we want to do something about this. But when we have pain, our natural response is to do less of those activities that are causing us pain. So if we're looking at an arthritic joint, we're going to do less walking. We're not going to use that leg as much. Maybe we don't go up and down the stairs with that leg, or we avoid putting as much pressure on it. So with that pain, we start to reduce the activity that we are doing. Now, because our body has a use it or lose it policy with a lot of its systems, if we're not doing the activity, we're starting to lose some of the muscular strength because we're not using those muscles around that side because we're avoiding the activity. Therefore, we're losing that muscular strength. But we also don't tend to take that joint through a full range of motion. So the amount of movement we're getting into the joint is reduced. So we actually start to lose some of the range of motion because the tissues are tightening up around that joint as well. Now, once we've started to reduce the muscular strength, we reduce that support that the muscles are supplying to the joint. So the less muscle strength and therefore active support, the more load gets put onto the passive structures and then onto the joint itself. So we get increasing stress going onto that joint. And for most people, particularly if it's an arthritic change, the more stress or load you put on the joint, the more pain you get. So therefore, the more pain you get, the less activity you do, and we again reduce muscle strength. So this is a bit of a vicious cycle that goes on. And one of the key things we want to do with some pre-surgery exercise and activity is to stop this cycle and hopefully reverse some of the effects of that. But it also comes with some other factors as well, because the less we do, often associated with some weight gain. It's very easy to stop our activity. It's much, much harder to stop how much we're used to eating as well. It starts to change the way that you walk. So your gait pattern or the way you walk becomes modified. Now, that manifests itself in a bit of a limp, or maybe the trunk leaning over to one side as you're walking. As that happens, it starts to put stress onto some of the other joints. So are we loading up the other side of the body, and that's taking more load? Or is that limp that we're doing starting to affect the lower back or some of the other areas around the body as well? Now, none of this process is fun or anyone enjoys it as well, so it starts to get you down after a while as well. So really with some pre-surgery exercise, one of the things we want to do is, again, stop this pain and inactivity cycle and get you in a better shape to have surgery. So the key factors that we always want to look at when we're getting fit for surgery really is about improving that lower body strength particularly if that's where your affected joint is, restoring the strength into the musculature around that joint. Also, improving the range of motion or the amount of movement you've got in that joint as well. Your pre-surgery range of motion is highly correlated with your early post-operative range of motion. So the better we can get your range of motion before surgery, the easier it is for you to regain that movement after surgery when the joint or the area is painful and swollen and the like as well. Now, we shouldn't neglect your upper body strength either. So if you're having surgery on the lower body, you're going to need to rely on your arms a little bit more for moving around the bed, shuffling across the bed, using crutches, getting yourself in and out of chairs and the like as well. So if we can improve your upper body strength as well, it just makes that process so much easier and you'll feel like you breeze through the recovery much better from there. We also want to have some discussions when we're looking at this pre-surgery component, and we do this in cooperation with your exercise, to manage your expectations of the outcome following surgery. So most people are disappointed with the outcome of their surgery because they had unrealistic expectations of what they were going to be able to do post-surgery. So in a pre-surgery program, we can actually look at your level of function and say, look, here's the movement you've got in the joint now. This is what you should expect after surgery. Here's the activities you can do now. This is what we expect you to be able to do after surgery. And making sure those expectations are aligned with your expectations as well. And finally, we want to incorporate some pre-surgery education. Again, setting some of the goals through that post-operative period where you should be. A lot of people feel a bit disheartened about their recovery and they don't feel like they're going as well, when actually they're actually following a really good recovery timeline. But we're always a little bit impatient. We want things to happen a bit quicker. But if we can discuss that timeline before your surgery, you're better prepared. Looking at how to prepare your home and the like to make that post-operative recovery period easier. And also teaching you how to use your crutches or other aids that you might need before your surgery as well. So I'm going to dive into a couple of those key aspects now in a little bit more detail for you. The first part is about improving your joint range of motion before surgery to make it easier for you to get a better range of motion after surgery. Now, there's a couple of ways that we want to do this, and it's relating to how the body is reacting to the pain and inactivity cycle that we looked at. So the first part, we need to start to stretch out some of the connective tissue and the musculature around the joint. If we haven't been taking our joint through a full range of motion because it's been painful or there's a restriction in the movement itself with the bony architecture of the joint, the muscles and the connective tissue around your joint tends to tighten up to work best through that range of motion that you have been using. So we do want to start to stretch out that musculature a little bit. The next part is working on some of those hypertonic muscles. So when your joint is in pain, your muscles tend to tighten up around that joint to try and protect the joint. So it's your kind of body's protective mechanism, which has really been designed to protect the joint whilst the joint or the injury site has been healing. But if we're looking at arthritis, for example, this is not something that heals on its own. It's we tend to be living with this for a longer period of time. So these muscles stay in this constant state of contraction, which then starts to limit the amount of movement that you take through that joint as well, because they never fully relax out and allow the joint to move. We want to overcome that with some of our stretches. And as we get through some active movements through your joint as well, we look at a process called reciprocal inhibition. So that is for one of your muscles to move your joint, the muscles on the opposite side of the joint have to relax. So if we take the arm, for example, here, my bicep muscle here to contract and bend my elbow, the muscles at the back have to relax. So we can use exercises in terms of bending the joint to help relax the muscles that are restricting that movement as well. So I wanted to take you through a couple of demonstrations of two very easy stretches that we might do for the lower limb. that I find are most effective and very easy to do as well, that anyone can do at home. And I'll set ourselves up so I can show you a demonstration of these couple of exercises. So the first one we're going to look at is to stretch your quadricep muscles. So these are the muscles at the front of the thigh, but also up into the hip. So I'm going to set up here with 2 chairs. The chair in front is purely just for balance, and we're going to be putting our foot on the chair behind. So first thing we're going to do is we're just going to take our foot up onto that chair. I'm going to take that foot as far back as we comfortably can. As we start to stand up tall, you'll start to feel this stretch through the front of the thigh. And if you've got a knee-based problem, often you'll probably feel more through your quadriceps here at the front of the thigh. If it's a hip-based issue, the hip flexors here at the front become very tight. So as you stand up tall, you get a stretch through the front of the hips. When we're trying to stretch the connective tissue and the like in the muscles, long, gentle stretches are most effective. So really, if we can hold this stretch for 60 seconds, but it's a gentle stretch we're feeling it through there, but it's not uncomfortable. Because if it's giving you pain or it's uncomfortable, those muscles tend to want to contract and restrict that motion. So long, gentle stretches for 60 seconds is going to be most beneficial from there. And again, you can always do both sides. We also want to look at the musculature down the back of the leg and into the back of the knee as well. So the easiest one here is for you to set yourself up sitting on the edge of your bed. Is probably the easiest way to go. So you've got that affected leg up on the table or up on the bed. Your other leg can hang down comfortably. When we have knee-based issues, particularly knee osteoarthritis and the like, tend to get a lot of contraction and shortening of the muscles behind the knee. And people tend to want to walk with a slightly bent knee. So we do want to look at straightening that knee out. So if we're looking at the knee, we want to try and get that knee straight and your toes up towards you, and you'll start to feel a stretch to the calf and into the back of the knee. But your hamstrings a bit higher up become quite tight as well, particularly with some of our hip-based issues. So that's where we're sitting up nice and tall, and we're just leaning forwards, and we'll get a longer stretch all the way up the thigh. Again, a nice long stretch for about 60 seconds. So it's a constant stretch, we're not bouncing up and down at all. Nice long gentle stretch for 60 seconds. So they are a couple of very gentle stretches that you can do at home, particularly if you've got an affected hip or knee. We also want to look at improving your muscular strength. And this is probably one of the most important aspects where it can help to accelerate your recovery after surgery. So the stronger you are before surgery, the quicker it is going to be for you to get back to your activities of daily living or your sport and recreation type activities after surgery. So when we're looking at our lower body exercises, we want to look at weight supported exercises. So exercises where we don't have all of our body weight going through the joint, because the more load we put through the joint, the more likely we are to aggravate pain in the joint. And the goal of our strengthening exercises is to get the muscles contracting without aggravating any pain around the joint itself. Now, a couple of things happen to our musculature when we've had a painful joint. The first thing happens is we get a lot of inhibition of the muscle contraction because of the pain. So when we get pain in the joint, we get a reflex response to the muscles that tells the muscles to actually relax or stop pulling so hard, because they're pulling around the joint and your body thinks it's loading up the joint and giving you pain. So that pain is inhibiting the contraction of the muscles, and then we change the way we move and the like to compensate for that. So we actually want to get those muscles activating again. Really, it's about getting that link between the brain and the muscle working a little bit better. So when your body calls upon that muscle, it's more effective in its contraction. In conjunction with that, the inhibition of the musculature because of pain reduces the number of muscle fibers that are actually contracting in that muscle when your body's been calling on the muscle to contract. So they anticipate an inhibited muscle only has about 30% of its muscle fibers contracting when you ask the muscle to contract. With some exercise, we boost that up to about 70% of the muscle fibers. And that's a process that happens very quickly. Within 1 to 2 weeks, you get more muscle fibers starting to contract. So the more muscle fibers you have contracting, the more strength or the more torque that that muscle starts to produce. So you get a very rapid increase in strength because of this neuromuscular change that we get. So even if you've only got 1 or 2 weeks before your surgery, there's still real benefits in doing exercises before surgery to get that link between the brain and the muscle going, but also increase the number of muscle fibers that are contracting. And that's where you'll feel like after a couple of weeks, oh, I do feel a bit stronger from my exercises. Your muscles haven't got any bigger at this stage, but they are contracting more efficiently and more effectively. The second stage of changes in your musculature is what we call the muscle hypertrophy. So this is the increase in size of the muscle. Now this only occurs after 6 weeks of exercise-based training. So this is really the optimal time frame that we would say for people to be exercising for before surgery. So we can see some of that muscle hypertrophy as well. So that's an increase in size. And as we build through an exercise program, we want to go from exercises that start to activate the muscles and get that link between the brain and the muscle working effectively, through to exercises that replicate some of your activities of daily living. So things that make it easier for you to get up off the chair or off a low seat, going up and down the stairs and the like as well. But we also want to teach you some of the post-operative exercises you're going to need to do after surgery. So if we can teach you and teach those muscles and the joints how to do those exercises now, it's much easier for you to do them after surgery when the joint's painful and swollen and we're trying to teach you at that stage. So we'll run through some of those post-operative exercises as well. Again, we talked about the benefits of some upper body exercises. So we can't neglect the upper body because that's going to help you in your general mobility as well. Talk about if we're getting off a low chair or off the toilet, if we can use our upper body strength to assist us, but also if we're going to be on crutches for any period of time as well, getting that strength into the upper body is going to make it much easier for you to get around on your crutches and the like as well. So I've just put together 2 simple exercises that we can do to look at some key areas around the knee and the hip. So we'll start with this first one on the left of your screen there, which is going to look at the muscles on the outside of the hips, the gluteus medius. And these are the muscles that are most affected by pain in the hip joint. So this is the area where we see most weakness. So again, this is an easy one we can do at home. If we set this up so we can see what is going on here. So all you need is, if you've got an elastic band, then that will work really well. If you want to be thrifty at home, you can get an old bike tube or something like that and tie that around your legs, or some of these loop bands as well are also very effective. Or you can just do it isometrically with an old belt or something like that. So I'm going to slip this over my feet, and I've got the band sitting just above my knees. I'm going to bring my feet out to about shoulder width apart. I'm going to push my feet into the floor, and that's going to start to contract my buttocks. So we're using these muscles then in the buttocks to draw the knees apart. And just bring the knees out so they're in line with your feet, and then we're going to hold it there. And this is more of an isometric exercise. So isometric means we're contracting the muscle, but we don't change the length of the muscle. So we're not really moving the joint. And this type of exercise is well tolerated by an arthritic joint. So the contraction of the muscle compresses the joint, but it doesn't have it moving. So the 2 bones aren't sort of grinding along each other as we're contracting. So it's not a big movement in and out. We're just going to push down and hold. You can start with a 10-second hold and then relax and do a series of 5 or 6 of those. And you can build those up to about a 30-second hold. And again, the more you do, the more muscle work you get, but you want to build up the amount of repetitions that you do over time. So this is a very effective seated hip abduction, we would call this. Pushing the legs down into the floor, bringing the knees out, squeezing the muscles in your buttocks to do that action. Now, if we're looking at the knee, for the knee, let's bring this back up so we can see our table at the top. It is our quadricep muscle at the front of the thigh that's often most affected. So that's this muscle in front of the thigh just above the knee. So at home, if you could be on your bed or somewhere comfortable, you could have your leg out straight. I've just got a foam roll here, but you could also just grab a couple of towels and roll them up to make a bit of a bolster. You're just going to sit that behind the knee. From here, I want you to keep your thigh down on the roll, and you're just straightening the knee, just lifting that heel just up off the bed, and that's contracting your quadricep muscle at the front. So it's going to be lift up and hold 3 to 5 seconds, slowly back down, and then lifting up again. Now, because we're just working at this last part of the knee range of motion, there's a lot less load going through your knee joint compared when your knee is fully bent and we're trying to extend it from there. So, again, it's an exercise that's well tolerated by the knee, but it does get these quadricep muscles activating as well. As we go through, we want to get into a bit more detail about getting some of these inner quadricep muscles contracting at the same time as well. So if we set up more of a structured pre-surgery program, we'll look at the balance of the muscles between the inside and the outside of the thigh as well from there. So, 20 repetitions of that each day is going to start to wake up that quadricep muscle, get it activating again, and then you'll start to use that during your activities. It's also one of the exercises that you'll most likely be doing after surgery as well. Now, exercise is not just about strengthening up the muscles and the range of motion. There's some other benefits that will start to come from your exercise as well, particularly if you've got a longer period of time before your surgery. Obviously, as we increase our activity, that can assist with some reduction in your body weight. Exercise will only give about 30% of that whole process that you need. So looking at the dietary or the food that you're eating is going to give you 70% of the benefit in terms of weight loss. So the exercise should be combined with some changes in your diet and the like as well. And again, we've got people here that can take you through that process.
Yeah, dietitian on site.
Yeah, well, we've got one of our exercise physiologists who does metabolic testing and also looks at your the nutritional aspect of what you're doing as well from there. As we start to exercise the muscles and the like, it's also getting your heart pumping more blood around the body. So, and some of these exercises will get the lungs and the respiratory system working harder as well. So this is actually helping to improve your cardiovascular system. Now, if we take a fact around knee replacement surgery, there's a 20% increased risk in having a cardiac event after knee replacement surgery. So if we can improve your cardiovascular fitness, it actually helps to reduce the risk of any other unwanted events associated with that surgery as well. So it's about helping you go through that anaesthetic process and that early recovery as well. So getting fit from that aspect is also really important. It also, doing some exercise is also going to change your body's metabolism as well. So looking at some of those metabolic risk factors, and so things like, if you've got slightly high blood sugars and the like, these become small but important risks in terms of having any surgery, as well as your lifelong risk and general health. And it's also important to become mentally ready for your surgery as well. So that's about setting those right expectations. It's about setting up your home before surgery, knowing that you know how to use crutches and the like. So you're more prepared going in for your surgery, and therefore you'll feel better about the whole process, and there's no kind of surprises in that post-operative period for you as well. So if you can't do anything else, if you can do some form of exercise is better than none. So if you can cycle a bike, that is an excellent way of doing some weight-supported exercise. So when we walk, we've got about 3 to 4 times our body weight going through our hip or knee joint. When we're sitting on the seat of the bike pedaling, we've only got about 1.5 times our body weight. So there's a lot less load going through your joint, which means we don't have that aggravating forces going through, upsetting those arthritic joints. So cycling is good if you've got the range of motion to be able to do that. But also getting to the local pool and walking in some waist depth water. The supportive nature of the water means we've got much less load going through those lower limbs when we're walking in the water, because the buoyancy of the water is holding us up. But we've got to push harder to get through the resistance of the water to go through. So it's working the muscles harder without putting the load through the joint. Next phase is really, if we can just teach you some of those post-operative exercises that you need to do and get proficient at those during surgery, that will have some benefit. Really, the ultimate benefit is going to come from doing more of a supervised pre-surgery program. So where we can put together an individualized program for you, target that musculature that has been most affected because of the pain and the inactivity cycle that we've been seeing. You do a lot of that other sort of education process as well. So what we recommend in a pre-surgery exercise program would be 2 sessions per week of structured exercise, where we're looking at strengthening the lower body, strengthening the upper body, exercise on the cardiovascular system as well, and looking at trying to improve that joint range of motion for you as well. We have some special pre-surgery programs that we run in the clinic through here as well. So certainly welcome to inquire about those as well. We can go through the details and build something that would suit the individual. If anyone does want to discuss any aspect of what we've talked about today in terms of getting fit for surgery, I'll put my email there on the screen, brendan@hfrc.com.au. Feel free to send me an email and we can start a conversation from there. You can also call the clinic and we can always arrange a time to chat. So no obligation to have a chat. It's just about talking about your individual situation and looking at what we can do from there. And will also be more details on our website as well. So that is all I had for today. Again, the message here is that anything you can do is better than nothing, but the better prepared you can be for your surgery, the quicker your recovery will be and the easier recovery will be. So that it's important to get fit for surgery.